Diabetes mellitus. The three most common presenting symptoms are thirst, polyuria, and weight loss. Other presentations include pruritus vulva, balanitis, and tiredness. Polyphagia, as excessive appetite or eating, is very rare and suggests coincidental thyrotoxicosis. In the newly diagnosed middle-aged diabetic patient, loss of appetite is sinister and suggests carcinoma of the pancreas. Hyperglycemia may be asymptomatic and are diagnosed at routine medical examination, for example, for work or life insurance. In others, the hyperglycemia is undetected until the patient presents with a diabetic complication. For examination, the purpose of examination is to confirm the diagnosis, classify the type of diabetes, and also detect any complications. Confirmation. In health, the blood sugar levels are remarkable, constant, and rarely outside the range of 3.5 to 8.0 millimole per liter. So in those who present with symptoms, as a single fasting blood sugar over 8 millimole per liter or a random value of over 11.1 millimole per liter clinches the diagnosis. Glucose tolerance tests are rarely necessary. Classification. Diabetes is like anemia and jaundice, a syndrome with many possible causes. An important part of the history and examination is to look for these rare causes. The causes of diabetes include Cushing's syndrome, acromegaly, thyrotoxicosis, pheochromocytoma, even Conn's syndrome, which is hyperaldosteronism. Others are hemochromatosis, chronic pancreatitis, and carcinoma of the pancreas. The rest are drugs, for example, steroids, diuretics like thiazide diuretics, and very rare genetic syndrome like Ditmore, as a mnemonic for diabetes insipidus, diabetes mellitus, optic atrophy, and deafness. Beta blockers do not cause diabetes per se, but they suppress the therapeutic sympathetic induced correction of hypoglycemia. Most cases of diabetes are idiopathic and are simply classified as insulin-dependent type 1 or juvenile onset diabetes as IDDM, or non-insulin dependent type 2 as NIDDM, or maturity onset diabetes. For the complications, as the presenting feature of diabetes are usually present in middle-aged and elderly, where the diabetes has been present for a long time. These complications include retinopathy, nephropathy, and neuropathy. Others are claudication, angina, heart attack, and stroke. The rest are necrobiosis, lipoidica, diabeticorum, and even cataracts, and psychological problems and hyperlipidemia. The diagnosis of diabetes is easy, and most newly diagnosed patients will have no physical sign. However, when one finds a raised blood glucose, one is diagnosing an incurable but controllable illness, the treatment of which requires more patient participation than most other illnesses.